Democrats respond. Moderate Dems in the Senate say there's no way the bill labor wants could ever pass their side of Congress. With us now is Congressman Adam Schiff, Democrat of California. Good morning, Congressman.
Good morning. How are you?
I'm well. So union leaders are pretty vocal about what they would like to see in any health care reform bill. They don't want a tax on the so-called Cadillac plans because many union members have those high-priced insurance plans, but they do want a government option. How will lawmakers deal with those two demands?
Well, it's really going to be tough. I mean, this is crunch time. I think when you had all these 5 committees working on different formulations, the end goal was still somewhat remote, but now that they've all passed out of committee and the final negotiations are taking place, so we'll determine what bill actually comes to the floor of the Senate and the House. It's crunch time, so everyone is weighing in. You've got certainly labor unions weighing in for working people. You've got the insurance industry weighing in a much bigger way. You've got doctors weighing in, hospitals, consumers. So everybody is at the table and fighting and scrapping and realizing not everyone can get everything they want,
sure,
and they've got to really pare it down to what their essential priorities are.
Yes, but a compromise may not be possible given all these divergent interests. Here's the dilemma. The measures that unions want, okay, they are opposed by most Republicans. They're opposed by even moderate Democrats. So I know that some of the House bills reflect some of these interests, but this seems untenable. It seems like this is a deal breaker. How will you hammer this out?
Well, it's going to be tough, but I think at the end of the day, all of the stakeholders that favor moving forward with a health care reform realize they're going to get some of what they want, but they're not going to get all of what they want. And how we, kind of get through this hole in the needle is going to be a challenge. But I think the reason why the negotiations are so intense right now is there is a new sense of optimism that actually a bill will get to the president. I think up until now there was some serious questions, but now there seems to be real momentum to actually pass a bill. So that means that all of the folks that are weighing in realize that they're going to make the toughest case they can for what they want, but at the end of the day, there has to be a reform. We have to make progress.
Okay.
We can't see health care costs going up so dramatically every year, 3 times faster than wages.
But it sounds like the union leaders hold some leverage, and they do so in the form of all of their financial contributions. You just heard they contributed $75 million to federal or national candidates in 2008. So are you saying that Democrats won't be swayed by the unions that are saying, hey, you know what, we're going to withdraw our money and we're going to withdraw our political support in the next election cycle if you don't do what we want?
I think a lot of Democrats will be moved, not so much for the reason you mentioned, but rather the fact that many Democrats ran for office because they were concerned about the fact that the American dream was slipping away from a lot of working people and middle-class families. And the preeminent goal here is to make health care affordable for the middle class. So to the degree that you have large sectors of working class and middle class families weighing in and saying, hey, this may affect us in an adverse way. This Cadillac tax on insurance plans may actually impact working people who have been lucky enough to get good health benefits at the expense of not getting good wages, get good wage increases. Yes, it's going to affect them because, a lot of why they're in this effort is to make life better for working families and middle class families. But, you have all these stakeholders weighing in on both the Democratic and Republican side. And, not everyone is going to be able to get what they want here.
Yes, it just seems as though the unions carry a bigger megaphone than some of the other constituencies because 92% of that $75 million we just talked about went to Democrats in 2008. So it seems as though
you could say the same thing, Allison, about you could say 92% of the insurance industry contributions went to Republicans, or 70% of the doctor contributions went to Republicans. You can look at those numbers too, and I'm not saying they have no impact, but at the end of the day, I think the members are going to vote their consciences, and they're going to look for the best health care plan that reflects their priorities. And the Democratic priority right now is to reduce health care costs for middle-class families, extend coverage to millions of people who don't have it. And I think that's the prism that the majority is going to look through to decide, is there going to be any tax on Cadillac plans? Is there going to be instead other revenue raisers?
All right.
What kind of a public option will there be? There will be, I think, pieces of these things in combination. But again, everyone's going to have to give if we're going to be able to be successful in a compromise.
All right, Congressman Adam Schiff, you have a tall order there on Capitol Hill. Thanks for joining us to talk about it.